Next from Springfield, we talk with Pat Comstock, the Executive Director of the Healthcare Council of Illinois. We hear what impact the state's financial crisis is having on services provided to nursing home residents. We also hear about the impact the state's late payments are having on those who operate nursing homes. This runs about 10 minutes.
Pat, there have been a lot of changes in the last year relative to the financing of Medicaid, and one of those industries that have been impacted have been the whole nursing home sector. That population, as baby boomers retire, is going to just continue to increase. What has been, in the year since the legislature passed the SMART Act, which was a reform of Medicaid funding in the state of Illinois, what has been the impact on nursing homes?
The impact of the SMART Act on nursing homes has been dramatic. First of all, the nursing homes have about 3% less money than they did a year ago for the general care of nursing home residents. And we understood that the Medicaid program was in trouble, and you know, the governor and the legislative leaders agreed that it was about $1.6 billion in arrears. And so we understood that cuts were necessary to keep the whole program going. And there are 50,000, almost 60,000 people in nursing homes across the state that rely on Medicaid to pay for their care. So it was incumbent upon all of us to do whatever we could to keep the program solvent. However, since then, the payments that we've gotten from the state of Illinois, the payment cycle hasn't improved much. Right now, May the 6th, we're 6 months behind in payments. And it's hard to operate when you are only getting a check every so often. So it's not just that the state is 6 months behind, it's there's no predictability when a check is going to come. You know, facilities might get 2 months worth of payments in a given month and then not see another check for 3 or 4 months. And I know I couldn't operate my household that way, and I don't know how many businesses could operate not knowing when they're going to get their next check from their customers. So it puts a great deal of stress and strain on facilities that are trying to care for people every single day.
When you're paid as late as you are, when your members are paid 6 months in arrears, do you get interest payments for that being so late?
There is a program where facilities can apply for interest on their payments. Our interest is 1%. However, those...
So is that a year or a month, 1%?
It's 1% overall in the aggregate for a year. And our facilities, some facilities apply for it. But the problem is when you apply for that interest, it comes out of our line item or the pot of money that's associated with our care. So the more people apply for interest, that creates less money to be distributed to everybody else, therefore causing the payment cycle to increase again. So it's applying for the interest is rather a double-edged sword, and so not that many people do it on a regular and routine basis.
Right now, as we enter the last month of the current legislative session, one of the things that is being discussed as part of Obamacare is the expansion of Medicaid. The state is looking to expand Medicaid rules, which again is health care for the poor, but to expand Medicaid rules by as much as 500,000 individuals. What impact, if any, do you see that having on the nursing home industry?
The expansion of Medicaid is going to have sort of an indirect impact on the nursing home industry, in that we don't expect there to be cuts to our care as part of that expansion. And we think that as many people in the state that can get medical care certainly should. However, one of the problems with that is that group of 500,000 plus are scheduled to become part of the Medicaid program at the same time that the state has our residents scheduled to transition to managed care. And we're concerned there's not going to be the capacity in the state to take care of all of that at once, and that our residents will feel the pain, or will have to take a back seat to that expansion, first of all. But secondly, nursing home rates for Medicaid in Illinois are the lowest in the nation. And so we've been saying to elected officials that before we expand Medicaid, we ought to take care of the people that are already on Medicaid. And that's a consistent message that we've had over the years. Now, with this Medicaid expansion under Obamacare, the federal government is going to pay for this care for the first few years. However, we know from being in Illinois that once this care, or once people are on the Medicaid rolls, even if it's a pilot project, we don't have a long history in Illinois of discontinuing those pilot projects or discontinuing that care once people get on the Medicaid rolls. So in year 3 and 4, there is anywhere from $150 million to a $250 million hit to the state budget to continue that care as the federal government withdraws their support. So without a guaranteed funding stream, we're concerned about what happens in year 3 and year 4, and how that may impact the care that we're able to deliver to our residents in those out years.
Let me ask a little bit about the people you represent. You represent nursing homes. Are they public, private, or both?
We represent both not-for-profit and for-profit nursing homes around the state. About 500 facilities are members of our group.
How would you assess the overall health of your industry? Because obviously you're not making widgets. As the baby boomers retire, or even the baby boomers are going to have their own parents going into nursing homes. So it's impacting people, whether directly or indirectly. Mm-hmm. Obviously, hundreds of thousands of people across the state are impacted, therefore, and will be continuing to impact by the decisions being made now. So where, in a snapshot, are you as an industry now from a financial standpoint and from an ability to manage the challenges you face, given the financial health of the state of Illinois?
It becomes increasingly difficult to manage the challenges when the state is behind, the state is paying low rates. There's always a disconnect that occurs within state government. On one hand, we have the Medicaid agency that, along with the governor, makes some decisions about what they're going to cover and what they're not going to cover. But there's another state agency, the Department of Public Health, that actually regulates nursing homes in the state. And the regulators still hold us responsible. You know, let's just use dental care as an example. The state of Illinois said we're no longer going to pay for preventative dental care. If it's an emergency, and the state will define that emergency, if it's an emergency, they'll pay. But if it's preventative care, they will not. Well, that's one state agency. The Department of Public Health still holds the facility responsible for the quality of care of the resident. So the Department of Public Health is still expecting a facility to make sure that that preventive medical care or that preventive dental care gets delivered. So the facility gets caught in the middle of the policies of two different state agencies. On one hand, the payer, on the other hand, the regulators. And that's another thing that we've been advocating for about a year now, that when decisions are made by the payer agency, that the regulatory agency has to be involved so that they understand they need to lower their expectations of the facility when these kinds of situations occur. And so far, we're not doing a very good job of collaborating and merging those decisions.
Have you had conversations with the various departments and raised this as an issue?
We have been raising this issue, the issue of the state agencies making different decisions that put the facility and the resident in particular in the middle. We've raised this issue several times over the last few months. We'll continue to work
What do they say to you? I mean, it seems like an impossible situation that you're being put into, and it seems rather obvious.
And what the governor has done is he's created an interagency work group to try to help resolve some of these situations, but so far we don't see any resolution to these problems.
All right, well, Pat Comstock, maybe we can visit again with you in the future and follow up on this, but I appreciate you taking the time to discuss it.
Be happy to talk anytime. Thank you.
You're watching the Illinois Channel, an independent nonprofit corporation formed to provide gavel-to-gavel coverage of Illinois state government and other public affairs events taking place across Illinois.